Hello, everyone. My name is Valerie Manu. Welcome to today's webinar on the revised Phase 3 Childcare Guidance. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. We will share the recording and PowerPoint with webinar registrants after the session. Our participants are placed on mute for quality assurance. If you will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time, and we will collect these and address them during the Q&A sessions and throughout and at the end of today's presentation. With that said, I'll turn it over to Kathy Glazer, VCF President.
Thank you, Valerie, and welcome everybody. Simple agenda today, but lots of good information. We're pleased to welcome again Jenna Conway and Tara Ragland to provide some information to folks, and today specifically review a new dashboard that's available, as well as revisions to the Phase 3 guidance for childcare providers. Really appreciate that we have several hundred folks on the line to learn more today, and we'll also be sharing out the recording to folks afterwards as usual. So with that, we will suggest, I see a number of you have already started to type your questions in the question box. Hopefully some of the presentation will answer some of those questions, but we should have time once the presentation is over to take some additional questions and get some answers for you. So with thanks again, we are welcoming Jenna Conway, who's Virginia's Chief School Readiness Officer, and Tara Ragland, who is the Director of the Division of Licensing Programs at the Virginia Department of Social Services. With that, I'll turn it to Jenna.
Wonderful. Thank you, Kathy. It's wonderful to be with you all this afternoon and to see that number of attendees going up and up and up. I'm Jenna Conway. I'm our Chief School Readiness Officer, and joined with my colleague today, Tara, to talk with you about what we know in the field, to make you aware of a new dashboard that includes some childcare specific information, and then to walk through the updates to the Phase 3 guidelines. As demonstrated by Tara's and my presence, this is a collaborative effort between the Governor's Office, the Virginia Department of Education, and the Virginia Department of Social Services. And we've been working really closely together to be able to support this field throughout this pandemic. I wanted to start with two notes of appreciation. First, to thank you for all of the work that you've been doing day in and day out since March. Childcare has been open, from our family day homes to our larger centers, our faith-based programs, and more. We know that you have been open and serving kids and families, our essential workers, and then the broader audiences of families who need to return to work, and you've been huge in the lives of those families and in kids. And we know it's hard to be on the front lines of this epidemic, and you have been, and sort of unwaveringly for the last 6 months. I also wanted to thank everybody who's reached out. I know Tara's received email after email. I've received email. We've done listening sessions. We've been out and about, with masks and being careful. But hearing from you on what's working, where there are challenges, has informed our guidance each step of the way. And we take what we hear from you to our public health experts. And so ultimately, this is a public health crisis, and everything that we're sharing today has been influenced, and ultimately the big decider, or the deciders, are public health experts at the Virginia Department of Health. But note that every email we received, every insight that's been shared via phone or with 6 feet distance in person, that we are making sure to reflect back to the top and to our health experts, and always trying to strike the right balance between enabling you to do your jobs well, to serve kids and families in the Commonwealth, but also to keep kids safe, to keep educators safe, and to keep families safe. With that, Val, if you'll go to the next slide, please. And that kind of just walks through what we'll talk through. I'll talk through the first couple of items, and then I'll turn over to Tara to talk about the guidance and the key mitigation strategies. Next slide, please. Throughout this pandemic, we've wanted to share back with you the information we know about the sector. I think it's important, right? Sometimes it can be really isolating as one provider. And so as of last week, we were, as a child care sector in the Commonwealth, about half of our child day centers, just over half, 52% of our child day centers are open, with about the same number of our religious exempt preschools. So school is back in session across the Commonwealth, private school, public school, whether in person, hybrid, or virtual. And as we see, kind of more than half of our centers and preschools are open. Nearly 90% of our family day homes are open. And so again, across the Commonwealth, our smaller programs are serving as a vital lifeline for families and kids. We still have a lot of programs closed. And I think, if you look at how many of our schools are going virtual, if you look at the challenges we hear from you on getting staff in, making, kind of getting families comfortable with kind of, feeling that it's safe enough to come, those factors are still affecting demand, are still affecting your ability to operate. And so it's not surprising to see that just over 2,000 of our child care programs are closed. Only a small number of those are reporting to us that they're temporarily closed, so fewer than 100. So again, this is still, we are hearing from programs that they are temporarily closed, but interested in coming back. And that represents a pretty significant loss in capacity across the state. Since we've been tracking it, nearly 900 programs have come back online, and it's been a steady state between 100 and 150 each month, right? So, we continue to sort of be excited to see as more and more programs are reopening. Oftentimes they open, at sort of a smaller enrollment, and then they get bigger and bigger. We hope that some of the flexibility that Tara will talk about today with group size will enable some folks who said it wasn't financially foreseeable to be able to open now. But again, kind of continuing to make sure that we can bring us back as many of our programs that want to come back. And we know that at least half of you, at least reported in a recent DSS survey, are also sort of doing something new in terms of supporting virtual or hybrid learning. And so that's a big shift. You might have a 2-year-old classroom, and then there are the kids' older siblings in a classroom with laptops supporting kids who are enrolled in the public school system, but maybe not going there. Maybe that's 5 days a week, maybe that's a few days a week. But again, just letting you know, about half of the providers that are open are reporting to us, serving school-age kids. And then we are just wrapping up the second round of the CARES grant. Over 1,500 programs have been approved. Resources are going out. So we are excited. I think collectively that's over $40 million that's going out directly via cash assistance to providers across the state. Still, as you've heard me say before, and just want to say it again, repeat it today, the losses experienced by the field based on all of these closures, this extended duration of temporary closure, means that those losses far exceed the federal funding available. And so we continue to advocate both to our General Assembly here in Virginia, as well as our elected officials in Washington, D.C., that we need more resources to be able to provide more direct assistance to open providers across the state. Next slide, Bill. I wanted to walk you through, and for folks who are just calling in, this will be a little bit confusing. So I would encourage you to take a look at the slides or the recording once this is posted. But just to walk you through, there's some new information about how what's happening across the state in terms of coronavirus in your community. So the general rule of thumb remains the same. If you have a confirmed case or a suspected case in your center or your family day home, the first person you call is your local Department of Health, right? And they will then walk you through how to make the best decision as it relates to your particular circumstance. But we also understand you might want to know what's happening more broadly across childcare. And so here you see, this is the landing page for the COVID-19 dashboard in the Commonwealth. So this is, you go to the Virginia Department of Health website and you come to this dashboard, and it kind of gives you a sense of what's happening. It's a little bit tricky, but if you look at the middle of the page here and you go down, those rectangles at the bottom, they're actually tabs that you can click on. And if you click on outbreaks, you can learn more about what's happening in childcare. So again, you go to the VDH site, which is listed right here. You have to scroll down to the middle of the page and click on outbreaks. Otherwise, you just see the summary data that we've all heard every day on the news. Val, if you'll go to the next slide, please. If you click on outbreaks, then you've got sort of 3 sets of information. And as of last week, we now have specific childcare information. So before that, we had educational settings, and it included K-12, college, and childcare. And as you all know, there are lots of differences in how those different educational settings operate, and we see different rates of transmission, different things going on with coronavirus, like very different things happening in colleges than happening in your programs. And so we have split those out and are now tracking those. At any point on this dashboard, you can click on childcare and it will provide just the childcare information. So at the top, you've got the total number of outbreaks. In the middle, you can then look at, and this is data as of, I believe, Friday, or maybe even Sunday, yesterday. But this gives you for childcare, and based on the number of outbreaks, the actual cases associated with those outbreaks, as well as the deaths associated with the virus. And then you see kind of at the bottom, you can track it over time. So again, this is just a place where you can find childcare specific data across the state. I think the important piece to note here, and why we wanted to share this today before we talk about the phase 3 guidance, is to recognize what this means for the Commonwealth, right? So you're like, there's a lot of numbers and screen, kind of visuals here, but big picture, you all have been open for the greater part of 6 months. This dashboard goes back to April, and there have been roughly 39 or so outbreaks that are affiliated with 214 cases in childcare and 0 deaths. So, and remember, an outbreak is 2 or more cases at the same site, and that is an indicator of that maybe that was transmitted to site. Not for sure, right? We can never really fully track where one got coronavirus, but an outbreak is something to be concerned about because you have a couple of folks at the same place who have COVID or coronavirus. So when you think about the hundreds of thousands of kids that are being served, how many, right? Half of our sector is open. You've been open day in, day out, right? Kind of across the state. That's a remarkably low number of outbreaks and cases, right? Particularly relative to something like, for instance, college or university, right? Where they have not been open for most of this time, and look at kind of the higher numbers there. So wanted you to know about this site, but also to know that you should feel really good about the practices and changes you've put in place in order to keep kids safe, because at least as it shows in this outbreak data, specifically about childcare, that what you're doing is working. Trying to keep kids distance, keeping staff distance, having folks wear masks, all of those practices are leading at least to fewer outbreaks in childcare. And that's important, I think, both for you to know that we know, that kind of shaped our comfort level in terms of for our health experts on some more flexibility in this phase 3 guidance. I also think it's important to kind of think about sharing this with families and others who might be concerned, well, are we doing enough? Is it working? And certainly based on this data, that, as a sector, there are a lot fewer outbreaks, right, in childcare than maybe in some of these other settings, in large part based on the practices you've put in place. Next slide, please, Val. So, and again, this is the total. So again, since April, this is a total of 213 cases associated with 39 outbreaks, 0 deaths, and this is childcare alone. So, we know it's not nothing, right? We know that, that there have been 39 outbreaks. We know that many of you have had to deal with that kind of stressful circumstance of a confirmed or suspected case. Maybe it's a staff person, maybe it's a family member, maybe it's a kid, and you, again, are reporting that and handling that, and that's being reported, but we have across the board been pretty good at keeping those down. Some of those may also relate to community transmission, right, where a lot of families may have it. So you might have 2 kids come to the center. It doesn't mean that they got it at the center, right? They may have gotten it in their homes, but we are doing a good job that if that occurs, right, where multiple kids are coming to your program or staff are coming from a certain community and have it, you're doing a good job of getting on the phone with your local Department of Health, getting folks, sort of taking the right steps to reduce, right, the further spread. And as you sort of look at this chart, which takes us back from April, to last week, you see we're able to keep it low, right? It's sort of our peak is maybe 4 outbreaks a week, which is, again, not nothing, but when you think about how many thousands of sites we have open, how many hundreds of thousands of kids that you're serving, we think this looks pretty darn good, and wanted to share that with you as we track it and we go forward, and why we were able to work with our public health experts to offer you a little bit more flexibility. So with that, let me go to the next slide, please. Let me turn it over to Tara, who will walk you through, some of the updates to phase 3 guidance that come in recognition of what we think is some fairly positive data about your efforts to minimize outbreaks in the Commonwealth of childcare.
Thank you, Jenna. And I just want to reiterate our appreciation for all the hard work that you folks have been able to do, and the mitigation strategies, obviously, that you've put into place, and the success that a lot of you have had. It does speak volumes. And again, I think why we can look to this new phase 3 guidance update and the key changes that we're getting ready to talk about. So on September 24th, the Department of Social Services updated the phase 3 guidance for child care and day camps. That included group size restrictions. It lifted those group size restrictions. Dolly regulations, discussing facial coverings for staff, re-emphasizing key strategies to mitigate spread. Next slide, please. Programs effective September 25th, recommendations for modified group size for all ages are no longer in effect. So that's kind of a pretty big deal, and I think again speaks volumes to the work that you guys have done. Programs may resume operation under group size limits set by their license and or subsidy agreement. Programs are expected to continue to adhere to the adult-child ratios. Next slide, please. Facial coverings. We've had a lot of questions on facial coverings. Recently issued regulations from the Department of Labor and Industry require staff in child care settings to wear cloth face coverings. Face coverings are strongly recommended for children ages 2 and older. Providers should make face coverings available to children if necessary. Next slide. And remaining vigilant. You guys have done such a great job with this, and we'll reiterate, a lot of the stuff that we've talked about before on previous calls, but child care programs are really doing an incredible job of keeping children and staff safe and healthy. And again, we just can't say enough for your efforts. Updated guidance emphasizes key mitigation strategies, such as cleaning and sanitation procedures, including hand washing, cleaning and disinfecting high-touch surfaces, physical distancing, including maintaining that 6 foot of distance, wearing a mask when physical distancing is not possible, and avoiding mixing groups. Monitoring for symptoms of illness by screening children and staff upon entry and conducting regular health checks. And reminding families and staff to stay home when sick. That's very important. And next slide. So some key resources, I think we've identified some of those, and you'll see them hyperlinked throughout this presentation, but Virginia Department of Social Services Child Care website includes the updated phase 3 guidance and our revised FAQs or frequently asked questions. We will continue to email out updates to all providers as things change and as information necessitates. And let Jenna speak to a little bit of this too, but the General Assembly is still in special session, and additional funds may become available to support child care. We've seen a lot of stuff on this front, and we're kind of preparing on our end. So I'll let Jenna talk a little bit about that as well.
Yeah, thanks, Sarah. I think that just wanted to note before we turn to questions that as I said before, even with the things like the direct cash assistance, we know that it's financially really difficult to operate in this environment if you're open. We know we still have, half of our larger centers closed and are trying to work with our elected officials to try to use whatever federal or state resources we can to get them to you. And so we are crossing our fingers that there are a handful of proposals that are still alive that would provide kind of direct assistance to support childcare, and continue to advocate for that and let you know that there's at least that possibility, even if we can't offer specific details today. But we know that increasing the group size will help in terms of revenue, right? And we know that the budgets are tight, and we would never want to make a safety decision based on economic reasons, but when we look at the data, when we look at what's happening nationally in terms of kids and safety, when we talk with our public health experts, they think this is doable. And we have heard from some of you that these group size requirements were really making it, totally financially impossible, and you were facing down, potentially the need to close a classroom or a center. And so we hope this will help, but it won't stop us from continuing to ask for additional dollars, because even that, while that little bit will help, it won't close the gap. And so I wanted to kind of give you that heads up. So with that, Kathy, do you want to field us some questions, or how should we go from here?
Thanks, Jenna and Tara. Sure, we do have a good number of questions, and many of them are actually about mask use. So if y'all can prepare yourselves, we will start into that. I think you answered some of these questions, but lots of diligence about understanding what the requirements are. Do staff need to wear masks outside?
So I think what we say is, as long as you can maintain physical distancing, I think you have to continue to do that in order, to probably be able to take those masks off. Jenna, are you in agreement with that, or?
Yeah, that makes sense. I'm not sure if I know that the primary requirement comes from the Department of Labor regulations, and I'm not sure if they speak to indoors versus outdoors, or whether that has to be accounted for in the plan. But no, I agree with that, as you noted, Tara.
So maybe I'll just read a few of these questions, and y'all can say whether they really need to look through the Department of Labor regulations versus the guidance and recommendations put out through the phase 3 guidance. So are masks recommended outside for 2 and over? Do we need to put masks for infants too? Do staff have to wear the face coverings the entire day? Can they take them off on the playground and during nap time if social distancing is occurring? Are staff required to wear a mask at all times, or when they can't maintain 6 feet social distance? Y'all want to kind of take a swipe at that batch?
Sure. Let me start with just to clarify, and then I'll ask Sarah to type in. I think there's a pretty significant difference between staff and kids kind of coverings, and so want to make sure that we start there and then talk about the staff, because the staff is covered both by these guidelines as well as the Department of Labor regulations, and this is an important distinction. So this is encouraging kids 2 and up to wear masks. So this is encouraging, but not required. So the language in our guidance, right, is that face coverings are most essential in times when physical distancing is difficult. Face coverings are strongly recommended for children ages 2 and older, and please make those available to kids if necessary. That is not a requirement. That is a strong encouragement. And as I think we want to emphasize that, I think the evidence, even as this pandemic has played out in our country, continues to suggest that masks work, right? That facial coverings work, and that you know, that the safest thing is to have folks wear them. But this does not require it for kids. It's a strong recommendation, not a requirement. In contrast, the Department of Labor has an emergency standard that do require staff to wear cloth-based coverings, and there's the link to that website in the guidance too. But that's why that's a requirement, because it has to do with your status as, you know, as an employee rather than kind of as kids in your program. So again, strongly encouraged for kids, required, right? And you know, and in this place, DSS is really referring to DOLE, or the Department of Labor and Industry. That's why it's required for staff, as it is required for employees across the Commonwealth. Do you want to? So that kind of answers I think the kid questions. Folks are encouraged to provide for kids if you are wearing them. You know, we will not, you know, if you've got a kid, and again, the same rules following the CDC, if you've got a kid who, you know, can't handle a mask, if you've got, you know, kids sleeping, right, none of those things should have kids wearing masks. But getting kids in the practice of wearing masks is encouraged, particularly 2 and older. No infants in masks, please, right? No 1-year-olds in masks, please. Strongly recommended, not required for kids, particularly when you can't maintain distance. So again, more likely inside, you know, if you've got, for instance, kids, you know, kind of at the same center, or like needing to be kind of closer to each other, that's the most important time to have masks.
Okay. I think that's super helpful, Jenna, and just, you know, because a lot of folks do have, you know, questions about just looking for, you know, answers and advice around masks for children. And what I hear you saying is it's encouraged for 2 and older as an extra precaution, but it is not mandated. It is encouraged, and providers are asked to use their best judgment about what works best for their programs. I would just say it seems to me that it might be an extra step in protecting staff for children to wear those masks. But that is not as much. It is, you know, it's required for adults and encouraged for children.
Yeah.
Okay, thank you. Then if we kind of peel apart some of the requirements around staff, if we have staff with medical conditions that don't allow them to wear masks, is that okay? Or are they required no matter what? Can they get a doctor's note to excuse them?
Sarah, do you want to take that? Or?
Well, I think, you know, we talk about getting doctors' excuses, but I think that, again, I don't know that that's kind of come up on some of our stuff, but I would encourage that if they don't wear masks for whatever reason, they would have to maintain that social distancing, regardless of whether they had a doctor's excuse or not. I don't.
And, you know, we may just, you know, we will be having a briefing on Thursday with the Department of Labor, and some of these questions may be, you know, better posed to them as well.
Yeah, I think those are, you know, something for the VDOLE consideration, because those are.
Yeah. Similarly, questions like, can staff wear surgical masks instead of cloth? Face shields, are they now with the kind of the verbiage of cloth face coverings? Is that sort of ruling out some of the other types of masks and face coverings?
Yeah, I think probably a good amount of these mask questions are best handled by DOLE. I'm just looking at the standard right now, and it's very clear that nothing in the standard shall require the use of a respirator, surgical mask, or face covering if it would be contrary to the employee's health or safety because of a medical condition. So I think it looks like that's certainly one exception. I think we should ask about the outside as well. I'm not sure it means that explicitly, so that might be a question we've got to get clarity from them on, because I don't see that in the regulations.
Yeah, thank you. We'll definitely raise that again on Thursday. Here's another one that may need to be grappled with by the Department of Labor. Will child care centers be cited if the staff is observed not wearing masks? And that may also kind of match up with some other questions about will licensing inspectors be coming, inside into programs during this period of time on site.
Sarah, do you want to respond on that one? Yeah.
So, we want to make sure, because it is a requirement, that everybody is understanding of that. And, our staff have not had a lot of interaction in terms of face-to-face. We are ramping up and getting ready to probably, look at when we will actually go back out in the field for regular types of visits. We're not doing regular visits now. We're still doing the desk reviews and that type of thing. So, it would have to be pretty significant type of an issue before we would probably send staff out at this point. Again, we're hoping that by the end of the year, we can have everything ready for those special needs. But, again, if something happens and we, have a complaint or whatever, we will investigate it. And if need be, we will cite accordingly. So, but I would caution, folks, and again, we don't, really get into interpreting those Department of Labor guidelines, but there are some significant things that can happen in terms of how they can cite, for not wearing masks and those types of things. So I would just caution everybody to make sure you are really understanding of those regs.
Mm-hmm.
I think the other key point, beyond the kind of and I know you'll cover this more, Kathy, on Thursday, but the point emphasized to us as we were finalizing this updated guidance, particularly if we're going to be able to provide, more flexibility on group size, as a handful of other states have done, but certainly not all, is that relying on the other strategies is really important. And so we can clarify inside or outside, but I think, the Doleys suggest that, really as much as possible, folks should be wearing a mask. And I think while I know there's a question to come about, breaks from masks and whether or not you could work with your staff to identify a space or a time in the day where they could take their mask off and be safe. I get it, right? They're tough to wear all day, but I think and the reason I really distinguished in the beginning is that, like, the expectation from the Department of Health, from the Department of Labor, I think from, what we're hearing in terms of Department of Ed and Social Services is that you should be really, staff, adults should be wearing masks all the time. Like, it really is, that keeps them safe, it keeps others safe, right? And that when I think about the number of outbreaks, and again, we don't have a specific number on this, but the vast majority of those cases are adults. It's really staff who are at most risk. And I don't mean to scare anybody in saying that, but, I think from a perspective, what we do want to share is, we need to keep this workforce safe, right? And providers play a key role in doing that. And if there's any doubt, wear a mask, right? And so wear a facial covering. If somebody has a health issue, yes, an exception is needed, but otherwise, I think getting people really working with your employees to say, we should be wearing masks all the time is really important, not only to comply with these regulations, but also we are going into, winter and the flu season, and, we just expect there's going to need to be a lot of mask wearing ahead of us.
And, I see a question about if it is clear that some of the requirements are not feasible for childcare providers, is there a route for requesting a variance, and what does that look like specifically?
Certainly. Sarah, do you want to just high level walk them through? I mean, I think there's certainly things in the guidance, right, where we say, on the one hand, we know physical distancing that we expect that, right? On the other hand, there is a line in our guidance that says, we know that developmentally it's not possible, right? If a 2-year-old needs a hug because she's hurting, if an infant needs to be changed, right, she's got a wipe down, a 1-year-old who's, just gotten sick, like all of those things require you to be, within 6 feet. And the guidance says, right, sort of, we need to address the developmental needs of kids, right? So it uses this language to the maximum extent feasible. We know that can be hard to interpret. And so if you feel like you need to do something that is in variance, right, is different from these guidelines, we have a variance process. You can use that to document, get an approval from DSS, and then use that to kind of demonstrate to your families or to your, to your insurance provider, whomever, right, that you're still in compliance. Sarah, can you walk our audience through how you would seek a variance like that?
Right, and I just want to clarify a couple things. So, in terms of we call them an allowable variance, and you would go through your inspector and discuss that with your individual inspector in your area about any type of allowable variance. But we can only do variances on one, regulations, not code. We cannot allow any additions or deletions or anything like that regarding any code items. And so we do have things that are in code that are not, that are very specific. And then we have a set of regulations that we have a little bit more leeway with. So we have to be very careful whether we're asking, because we cannot do any allowable variance for code. Neither can we do an allowable variance for another agency. So, we need to be very specific to that. So when we talk about what we're doing here, with guidance and recommendations, obviously, because it is guidance and recommendations, we wouldn't need you wouldn't need an allowable variance. But for some types of things that that you can request a variance for are those regulatory things. And you go through your licensing inspector. You can find the forms on our website to request. I don't know if we have a form for that. I have to go back and look at that. Look, guys, it's been so long since I've had to get on that particular website. But when you get your, licensing inspector involved, they can walk you through the process in terms of requesting it. It's definitely something yeah, it's not on the web. Thank you, Sharon, for that. It's actually, you have to go through the inspector, so.
Got it. Thank you very much. We have a few questions that are coming up about the change in ratios, but the challenge of, returning to just the normal group size and ratios. But some of our center directors are saying that if they, with social distancing, it may not be feasible to be able to grow back, to those sizes. There are challenges in recruiting staff at this time. And what if, for example, staff refuse to wear masks? Just, kind of a number of different dynamics that I see are really challenging. The students still need to be socially distanced in the classrooms, even with the new going back to the normal time ratios and group sizes. If so, increasing the class size limit may not be feasible for many centers. Y'all have any reaction or response to that?
No, I think this is a flexibility, but not an expectation. And what we mean by that is folks may end up staying smaller if that's what their space requires, if that's what their family or their staff or their individual circumstances require. And so I think that's understandable. This is a case by case basis in terms of the layout, right? The physical layout, in terms of the the kind of the comfort levels of your staff. We wanted to provide this flexibility because we're hearing for some programs that were larger and had, and they were saying to us as families who had been known to them for years were coming back, that they were being sort of told to to sort of say no to families, right, and putting families in impossible circumstances. And so we wanted to offer that flexibility, but we also imagine that some places will, will kind of remain at their smaller numbers, if that makes sense, because of physical distancing. So, there's not a requirement that you have to go back, particularly if you need to if you have a smaller physical space. I think on the staff not wearing a mask, again, I will defer that question to Thursday. What I've heard before from these folks is helping folks understand the why. It is a state regulation, and so again, to Tara's point about where we can provide flexibility and where we can't, like regulation, rules are rules, and this one is fairly inflexible, and so trying to work with that individual or individuals to understand the why, to figure out, why aren't you wearing this? If they can document that there are medical reasons, then I think that is one out. But I think otherwise, employees need to be wearing masks because that's what the rules of our state say. And there's nobody at social services or at education can waive or create an exception there, unfortunately. As it relates to the staff issue, we are hearing that across the board, that it's really hard to hire, that folks are saying, hey, it'd be great if you change the group size rules back to normal, but I'm still having real challenge hiring. And we're trying to understand why and see if there's anything that we can do at the state level to better support you. I think, part of it is looking at our workforce, right? So it's incredibly difficult work. We also know that this pandemic has disproportionately affected our African American and Latinx families, and many of your educators may be African American or Latina or Latino, and that might be kind of an understandable concern in terms of bringing folks in. We know that there is a lot more kind of private market competition, right? I mean, we've got a lot of pods and folks who need care for all of the school-age children who are not receiving in-person education, and that is, making it harder to find caregivers and educators. And we know that it is hard to find great childcare teachers even without a pandemic. And so the work we've done kind of in partnership with the foundation and with social services, and why we, proposed and are piloting an incentive program, is that already, even before coronavirus, we had very high rates of turnover in this field. It's hard work, right? You are kind of already scrimping to give your teachers as much as you possibly can pay them, and yet, they'll turn around because they have to, right? Because they have to pay a utility bill or feed their family, say, they got to give this up to go to work at Walmart or Kroger or wherever. And so we hear that is happening, or trying to sort of think through if there are ways to help you. Certainly, if there are additional dollars, what we heard from you, right, is just getting you the direct cash assistance is helpful, right? Because for some of you, the additional costs are cleaning supplies. Like for others of you, it's about being able to offer your staff a bonus or a little bit more per hour, right? For others, it might be something different. You need to kind of move some, you need to create an outdoor classroom, right, in order to kind of go back to group size. So we hear this is a problem, and I think if we can get access to additional resources, we will try to get them out to you, so that you can, at least try to, use those funds to help resolve some of this problem. And we'll continue. If there's other ways, we are always open to suggestions on what we can do to help on the staffing front.
Thanks very much. And just, I'll state again, just seeing some of the questions that have come across, that Thursday is another opportunity for you all to register for a briefing at noon on Thursday. There'll be a representative from the Virginia Department of Labor to review again. This is the second briefing we have held on the new workplace standards that have come out from the Department of Labor based on COVID, the pandemic situation. This is a set of standards that are for all businesses, all workplaces, And those workplaces are categorized into low, medium, high, and very high risk. Childcare providers are determined to be medium risk businesses, and there are, regulations and requirements that all employers and workplaces are mandated to follow if they fall into one or another of these categories. And so the briefing on Thursday will give us another chance to understand very specifically for the childcare industry, what does that mean? How do these interface or interact with the guidance and requirements that are put out or sort of as provided by the Department of Social Services and the Department of Health. So they are standards and regulations that are intended to protect both the employer, the individuals that are staff and working in the locations, as well as the children. And so, it's a little frustrating and I'm sure confusing to try to figure out what, who's kind of calling the shots on what areas or another. But I think, the goal is for us to all to work together and try to make sure that we're creating safe learning spaces for everybody engaged and involved. And that's, as we know, in this pandemic world, not an easy thing to do. Let me shift to a couple of other types of questions. There is one about with the dashboard, Jenna, do the figures for childcare, does that include both children and staff?
Yes.
Great, thank you. Are there recommendations around restricting outside visitors? I know a lot of centers are really aided if there is a requirement that parents or visitors cannot come into the center. What's the status of that?
Tara, do you want to take that one?
Sorry, can you repeat that? I'm sorry.
I think it's about the outside visitors, which if we have any specific guidance related to outside visitors, which I believe has been removed from the phase 3.
Yeah, I think it's one of those things where we're just asking folks to, to be very mindful. You want folks that are going to be coming in or dealing with to maintain social distancing, to wear masks and that type of thing. And I think if there's any specific, they just, it needs to be vetted appropriately. I'm not sure in terms of what context. Is it just visitors or is it folks that are providing services?
This particular question was really about parents and just trying to maintain sites where they're reducing, the risk of transfer of infection. And so the more adults coming into the space, and in some cases, even parents, so there was a lot of, intention and sort of guidance around exterior drop-offs and creating entry and exits in such a way that protects.
Right. Yeah, we're still trying to make sure that folks maintain that. Obviously, if you're trying to maintain the integrity of your program, you want to limit visitors as much as possible. I think we, again, strongly discourage, that's our recommendation regarding outside visitors, because you really want to make sure that you're, kind of keeping that integrity of your, not mixing groups and that type of thing. So, the more folks you allow in, obviously, the more you open up to other types of, vulnerability, I should say. I mean, I don't know that you consider parents necessarily as visitors, but, I think in the original guidance we had, again, maintaining social distancing and asking them to wear masks, at drop off and pick up and that type of thing if they have any interaction. So,
yeah. Yeah, I think the other point I'd add to Tara's point is, again, there's less specific guideline or regulation here, but between our guidance and the CDC guidance, it's just about, minimizing the kind of contact, among adults. And so again, some flexibility here. It is certainly more flexible than prior versions of the guidance. On the other hand, think about the scenario, right? If one of those parents comes in with a confirmed case and they've, been within 6 feet for, 15 minutes or more with, a handful of folks in your staff, right, then all of those folks have to quarantine. And so that might be a helpful way of thinking about this from a different perspective, is that the more folks that you limit, then the greater ability it is to sort of, if for instance somebody has a confirmed case, you don't have to have as many people quarantine. And I think that's why we would still strongly encourage the outdoor drop-offs, the having all the contacts go through, one individual, right, that versus having to go to like multiple teachers and multiple kids, if possible.
Let's see.
I think the same is true, just as a reminder for folks and specials. And, when folks come, one of the things that there is not a prohibition, right, to Tara's point around folks kind of coming in to provide services. I would encourage people to be very thoughtful about, do you have the sort of, step and grow or the outsiders come in right now? You really want to make sure if you're doing that there's plenty of distance, that they're wearing masks, right? You might want to not do that right now, because if you have somebody come in and go into every classroom and that individual happens to be exposed, all of a sudden, and we've seen this happen in childcare, all of a sudden everybody's got to go home, right? If the music teacher comes in and is been within 6 feet of all of the kids, right, across all of the classrooms. So it's trying to, not a strict regulation, but really encouraging caution there, right, with just the note, just noting that this thing is very contagious and very widespread.
Mm-hmm. Okay. Also, a good number of questions about CARES grants, and will there be a CARES 3 if additional dollars are made available? People are concerned about sort of the drop-off, the cliff effect for when some of those funds, expire. Anything that you can share about looking in your crystal ball about what might come about additional grant dollars?
So I'll start, and Jenna, you can maybe wrap it up. I know we've heard some information from the General Assembly about, some items that are, over there. And so I think that we might be looking at a potential, CARES 3 round at some point. So, I know it's one of those things that I have to have my staff ramped up and ready to go. So we're kind of anticipating that that's something that's going to roll out. We haven't got the official word yet, so we're kind of waiting on that. But it's, I would say, highly likely. And if Jenna wants to use some different words, I'll roll it over to her so she can comment.
I would say there's two important messages. One is that we've heard, for those of you who receive these dollars, that they've been a really important lifeline, and that you appreciate the flexibility, and these are absolutely being, turned into, resources for your centers, for your educators, or for your kids. And we've tried to reflect that to our elected officials, both in Washington, D.C. and in the General Assembly. We have, and thanks to the incredible advocacy work of some of our nonprofit partners, they've also said this is not enough, right? And it's a cliff effect, it's looming, right? You're still operating with these really challenging, brutal budgets and need more relief. And again, we only have half the system open, right? And so there's a desperate need for additional assistance. I would, and neither Tara nor I are ever allowed to kind of directly encourage advocacy, but if we could, we would suggest that you reach out to, your General Assembly members now and say, like, this is really important. Like, we need assistance, right? The CARES Act runs out 9/30 in terms of at least the kind of CARES phase 2, excuse me. There's still a lot of CARES Act dollars out there. And this would be, if not the most important use, is certainly one of a very important use for the Commonwealth. And so the more that they hear from you, hopefully they can take that back turn that into an approved budget, and then Tara and team can get that out to you. So just encouraging folks to reach out. I know you've got a million things to do, but we would like to be in a position where we could get more direct assistance to our open programs, because we know it was helpful, we know it was useful, we know it was well spent, and we know you need more.
One more question specific to that, and then we'll talk a little bit about the briefing next week and wrap up for the day. While there were a good number of grants that were provided, some were rejected or not issued, and folks are just wondering a little bit about whether, if you could give a sense of the, the numbers of grants that were not able to be provided, and would those folks in essence move to the front of the line if there is a CARES 3?
So I don't have all the numbers right in front of me in terms of the CARES information, but I know that we basically processed, on a first come first served basis, and that was definitely the ones that were completed applications. We ran out of money relatively quickly, so there was, I think we had it open for a period of time, but it ran out pretty quickly. And so we continue to process grants through a certain date, and I'd have to check with Jessica on that number. Like I said, I don't have that in front of me. But we are trying to keep the ones that we had processed, so that if there is potential money in the future, that we will have those on file. Now, depending on how that money's directed, we don't know, how we would be determining grants in the future or anything like that, but we felt, necessary to kind of go through that process and kind of have a specific, cutoff. But it was, we had a lot of people apply and a lot of larger groups, and so the money went out really quickly. So, I don't know if that completely answers the question, but, we did, caveat at the very beginning of the process that it was on a first come first served basis. And, I know that that's not always easy when you didn't, maybe weren't one of the ones selected, or there was an issue and we had a specific cutoff date. But, I think what was difficult for the team is, we would like to be able to give this money to absolutely everybody, and we wish we didn't have to have specific rules and guidelines that we had to set up along the way. But, when you have a limited amount of resources, you kind of have to have some type of parameters that you build into things like this. So understanding that it's difficult, and understanding that, everyone wanted to kind of get some of this fun, some of the funds, that, was frustrating. So we definitely have some empathy for the folks that weren't able to get in on this last round.
Thanks very much. Just wanted to draw folks' attention to the chat box. There is a link to be able to register directly for the Thursday briefing. Some, I think, are able to use the link on the slide, and others are not. So please take a look at the link in the chat box. And as well, if you received an email for this briefing today, you'll be receiving an email later today to register for the briefing on Thursday. Also, there were a good many additional questions that we weren't able to get to, but we do provide the full listing of questions to our speakers, and they are generally very generous about reviewing and sort of hearing what questions are and what concerns that people have based on the questions that come forward. So we appreciate your attendance and your typing in your questions, and hope that many of them were answered today. Also, just want to thank again Jenna and Tara for standing before this group and sharing the information and responding to the many questions that come forward. And we look forward to some additional conversation and information about how child care providers and businesses should be proceeding in terms of regulations in this pandemic era. And again, we'll look forward to continuing the conversation about how to make sure that these really important, safe learning spaces are available to children and families in the Commonwealth, and appreciate very much your leadership in making that happen. Hope everybody has a good afternoon. Thank you.